All right, thanks a lot, Lisa. Well, as you know, June is Men's Health Month, and every Thursday we're taking a look at some of the health issues impacting men the most. This is part of Griffin Health's Initiative for Men, also known as HIM. Joining us in studio today are Ricky LaPera, Director of Cardiac and Pulmonary Rehabilitation, and Michael Desjordins, the Center for a Healthy Living Manager. Thank you very much for joining us today. All right, we're talking about heart disease as well as diabetes. Mike, we want to start out with you. How big of an issue is that for men right now?
Very, very big issue, Ken. 38.4 million right now, according to CDC data, suggests we have an active diabetes issue. Of that, 18 million or so men have diabetes, and due to our poor habits.
Poor habits. Let's kind of talk about the signs and symptoms of this disease.
Sure. So most commonly, you're going to see increased thirst, increased urination. Men can have blurry vision. And another one that goes unnoticed is a hunger after you've already eaten something.
Oh, wow. And Ricky, let's kind of skip over and talk about the heart. How big of an issue is it? And what are some of the signs and symptoms of heart disease that we may be experiencing?
Yeah, so heart health and heart disease in particular is a global health issue. It's not just exclusive to the United States. Around the world, it's the #1 killer of men and women. In the United States, it's attributable to about 1 in 5 deaths, or 1 death every 33 seconds. Right. So early identification, primary prevention, getting to your annual physicals, these are the ways that we can look out for numbers that are on the rise, because this process is fairly silent until it's an issue.
All right, now you talk about prevention. What are some of the changes that we can make immediately to stop this? For both of you guys, you start, Ricky.
Yeah, absolutely. So I like to break these down into what I call the parent rules, 3 simple categories. Things I was told as a child, and I'm sure some of our viewers also heard. First and foremost, my parents always told me, eat my vegetables, right? Go outside and play and do your homework. As an adult, that translates into language such as getting whole foods, getting our fruits and vegetables, getting our whole grains, and eating the right portion sizes. Going outside and playing is a little tougher as adults, but we have to consciously add physical activity into our lifestyles. All my men out there, mowing the lawn twice a week is not enough. We have to add physical activity into our lifestyles to promote long-term health outcomes. And then doing your homework is really just knowing your numbers, getting to your annual physicals, knowing your blood pressure, knowing your cholesterol, advocating for your health. Even if you feel fine, I implore you to get to those appointments so you know that you're in a good health status.
All right, and Mike, with you, what are some of the programs that Griffin Health offers the public right now in order to combat these diseases?
Sure, Ken. So out of our Center for Healthy Living, we offer programming that surrounds information, education on pre-diabetes, diabetes. We offer things around nutrition, tobacco cessation, sleep health, and more importantly, a heart health workshop, which goes along and provides that education that men really need. We're just bad purveyors of getting to those doctor visits, as Ricky said.
All right. Unfortunately, we're going to have to wrap things up real quick. But salt is a big issue as well, right, Ricky?
It sure is, yeah. So salt's a big problem. And just to lay that out there, on average, Americans get about 3,400 milligrams of sodium a day. The average recommended daily allowance is 2,300, so we're almost hitting about double of that.
Wow.
So understanding blood pressure and its ties to our salt intake, the more salt we consume, the more fluid that we retain, the higher our blood pressure, and that affects everything. Heart disease risk, cholesterol risk, diabetes risk, all the above.
All right, and with Father's Day happening this weekend, this is probably the best gift of all. Ricky and Mike, thank you very much for joining us today. And of course, there's more information about men's health issues on our website. That is WTNH.com. Stay with us. News 8 at 4 continues right after this break.
June is Men's Health Month, a time to take proactive steps toward a healthier life. A reminder from the Griffin Health Initiative for Men and the generosity of Frank and Judy Michaud through the Valley Community Foundation.